Thank you very much, everybody, for joining us. I'm Plum, CEO and founder of the Safer Air Project, and I'm pleased that you could all join us today as we explore why safer shared air in the workplace is not just a health issue, it's a critical matter of accessibility and inclusion. Before we begin, I'd like to acknowledge the traditional owners of the land on which we gather today. I am joining from the land of the Darramurrugal people, and I pay my respects to elders past, present, and emerging. Please do feel free to say hello in the chat and share the traditional lands that you are joining from today also. Just a few quick housekeeping items before we get underway. We'll begin with a brief overview, followed by short introductions from each of our speakers. Then we'll dive into a panel discussion and finish with audience Q&As. If you can please submit any questions using the Q&A button, we'll do our very best to get to them. And if your question isn't answered, we're also happy to follow up afterwards. Please just send us an email and the name of the panelist you're directing it to info@saferairproject.com. Finally, I'd like to thank our generous sponsors. A special thanks to our major sponsor, Camphil, and our supporting sponsors, Erlab USA and Sealy International. We're extremely grateful for your support in making this event possible. So, without further ado, let's get started. Today, we're turning our attention to workplaces, a space central to many of our lives, yet one where the air we share is too often overlooked. Since 2020, awareness of airborne transmission has grown. We now know that viruses like COVID-19, influenza, and RSV spread through the air much like smoke, hanging around and accumulating in poorly ventilated indoor spaces. And just like smoke, everyone shares that risk, but some of us are more at risk than others. For people with chronic health conditions and disabilities, that risk can mean serious health consequences or even exclusion from work entirely. But poor indoor air quality isn't just a health equity issue, it's also a productivity issue. Research from Harvard's CogFX study shows that when air quality improves with better ventilation and lower CO2 levels, cognitive performance improves significantly, including faster response times and better decision-making. In short, cleaner air helps people think more clearly, work more effectively, and feel better while doing it. Our Safer Shared Air report brought new evidence to light by reframing indoor air quality as a critical accessibility and inclusion issue. It highlighted how people with chronic health conditions and disability are being excluded from work and public life due to preventable airborne risks. So investing in air quality isn't just the right thing to do, it's the smart thing to do, because safer air supports healthier, more productive, and more equitable workplaces. Yet despite all this evidence, many workplaces are still failing to act. People are still masking without support. Others are quietly leaving jobs because the air isn't safe enough. This isn't just about comfort, it's about whether everyone can participate safely in work. That's why we're here today, to understand what's working, what's missing, and what it will take to move from optional to expected when it comes to safer air at work. So yeah, that's why we're here today, because everybody should be able to participate safely in work. And I'm delighted that we're joined by a brilliant panel. And our first guest today is Katherine Marshall. Katherine is the CEO of Inclusive Rainbow Voices, an intersectional disabled persons organisation working towards equity and justice for LGBTIQA+ people with disability. Katherine brings 15 years experience working in health, disability and LGBTIQA+ advocacy and policy development. In addition to their lived experience as a chronically ill, disabled, queer and non-binary person, Katherine has worked across government, not-for-profit and creative industry settings, leading projects and programs that promote accessibility, inclusion and justice for diverse disability communities. Katherine's approach is rooted in disability justice principles and a systemic outlook that seeks to build cross-disability and cross-movement solidarity. We really are delighted that you can join us today, Katherine. Thank you so much for being here. Over to you.
Thanks for that introduction, Plum, and thanks so much for having me. As Plum said, I'm the CEO of Inclusive Rainbow Voices, and as an organisation, we work towards equity and justice for LGBTIQA+ people with disability. And we do this through in a few ways. So we work on systemic advocacy and movement building. We work on capacity building and education, peer support, and celebrating community, and in working in solidarity with others. And today I'll be discussing a bit of my personal experience as well as my professional experience, um, and some reflections, I suppose, in the way that things have changed over the last 5 years for us working in this space. So as someone who is severely immunocompromised and who's worked in disability advocacy and health advocacy for a long time before the pandemic, it's been really interesting to see the shift in awareness and attitudes towards supporting immunocompromised people. In 2020, when we all went into lockdowns for COVID-19, for myself and many other people, this wasn't a new experience or a novel experience. I knew exactly what to do because I had done it before. And I've reflected many times with my peers who are immunocompromised as well about how we felt for the first time maybe in our lives that people were really starting to understand our needs, and our needs became the needs of the community, and we felt really supported and cared for in terms of our health and well-being. And when I say this, I often get the response, well, what about the damage that the lockdowns did? And if that is what you're thinking and that's where you're kind of jumping to, I would ask you to reflect on what life might be like if that was your normal, or if that was a place that you had to visit often, throughout your life. Disabled people often experience loneliness, loss of opportunity. Our work and our businesses do suffer. And so I suppose if that's your reaction in the beginning, I would, perhaps what you've experienced during the lockdowns was a taste of a life that others live and that others also learn to live well. And I'm not suggesting that we go back to lockdowns, that's not what I'm saying, but I don't want us to lose sight either of the nuance of the experiences, particularly of marginalised people during the different stages of the pandemic. And as we tell the stories of the pandemic and what it was like and the reality for many of us, I think it's really important to keep those nuances as part of that conversation, and resist that sort of urge, and particularly by the media, to sort of oversimplify coverage of it. And of course, as time changed, and here in Victoria, we went from very strict lockdowns, curfews, and restrictions to having almost no precautions at all, quite literally overnight. And as this happened, the Omicron wave was ripping through our communities, and many of us were left with this kind of whiplash and this feeling that we could have avoided both extremes if we'd had some really sensible approaches in place to begin with. And we had that feeling of, we were all in this together. Well, not feeling, we were told, it started off as we're all in this together, and then it moved all of a sudden to you're on your own, and this sort of personal responsibility, quote unquote, because of course there's no way for an individual to be independently responsible for the air that they breathe. Air as a shared resource, I'm sure that's not news to anyone, and we all rely on it to live, and to live well. And what I would really like to see is for governments and organisations and leaders to bring sensible conversations into the public that put aside these sort of conspiracy theories that seem to fester in social media, and have really frank and open discussions about how we do approach this collectively, because it does impact everyone. And I think while there has been little leadership in place in terms of, our governments, perhaps, and our larger organisations and leaders, that leaves this vacuum, and the vacuum is being filled by misinformation and quite frankly, people who are trying to drag the public into their harmful ideologies. And I think we need to fill that gap with solid information and sensible discussion and leadership on this issue. And as we go through this process of kind of, from trying to move from where we are now to a place where we have safer shared air, or safer air, I would really invite people to look to the leadership of people who've been advocating for justice in healthcare settings and disability justice for, decades, centuries, because while the issue has really changed, absolutely, in many ways, it's not really new either. And we do have movements here, our disability justice movements and our health justice movements that have been doing amazing work for a long time. And I think, we're in this together, and we've got a lot of examples of things that have worked well, things that haven't worked well, and how we can really keep our communities connected and informed, particularly during these periods of misinformation and disinformation. I think there's an important role to play for organisations, also for individuals and community leaders. I think that the stronger our communities are, the better we can care for each other and work collectively towards change. And that's why I'm so happy to be here today, having this conversation and working with Safer Air Project, who are doing really amazing work as leaders in the space. So thanks very much for having me.
Thanks for joining us, Katherine. It's fantastic, and thank you for sharing your experience. I certainly remember that feeling of whiplash, and and as someone who's kind of spent my whole professional career working in health policy, that sort of sudden realization of, well, hang on, it's an airborne virus. How do we as people living with chronic health conditions protect ourselves in the absence of any policies that make the air safer? And obviously that's that was what meant that Safer Air Project was born to address. So absolutely, I know exactly how you feel, and I feel that very deeply. So thank you very much for being here today.
Thanks for having me.
Okay, our next speaker this morning, or this afternoon, is Greg Hunter. Greg is the Historical Collections Administrator at RANSCOG, where he manages their historical collection of medical paraphernalia and books. He is also Collections Registrar for the La Trobe Art Institute, where he is responsible for the care and management of the 7 art collections owned by La Trobe University. Alongside his work, Greg volunteers as a council member for the Australasian Registrars Committee. I knew I was going to trip up on that one. A not-for-profit organisation dedicated to promoting and supporting the work of those involved in caring for and managing collections in the GLAM, which I love, is the galleries, libraries and museums sector. Greg is interested in indoor air quality due to the challenges inherent in turning up for work and living everyday life during an ongoing pandemic. Thank you very much for joining us, Greg.
Thank you very much, Plum, and thank you everybody for coming along to sort of learn a bit about indoor air in the workplace. I'm very honoured to be here. My name is Greg. My pronouns are he, him, and as Plum mentioned, I sort of wear many hats, and I think I would start by saying I'm one of the people that Katherine spoke about briefly, as in before the COVID pandemic, I really didn't have any conception about safer air or about immunocompromised people or about sort of the precautions and the steps a lot of people have to go through just to sort of safely interact with the community. And even when COVID started and the lockdown started, it took me a long time to sort of get up to speed with that. I was angry, reluctant, didn't sort of see the point of a lot of it. But, as I learned and as things progressed and COVID wasn't going away, I sort of started to really see how much all of this was affecting everybody and what it was doing. So yeah, I work with collections, so objects, paintings, all sorts of things like that. Because of the nature of the work I do, it's difficult for me to work remotely because I need to have access to those objects in order to do my work successfully. So while I applaud and appreciate the move towards remote working, there can be a bit of a perception that by making your workplace accessible to work remotely, you are making it accessible, but you're not if there's people that still need to come into the office because of the nature of their job and they need to actually be there. They don't have the option to work from home, then you still need to be sort of aware of that as well. And that's sort of something I've been navigating as part of all of my work. So I'm wearing a respirator mask today because I am in one of my workplaces today in a shared work environment. So I'm doing my part to sort of protect myself and to protect others that I'm working with today. And I do appreciate I have a lot of support from both of my workplaces in terms of my ability to mask at work and to take time when I need it to eat and drink and so on and so forth. But it's always a challenge, and I have to take public transport to work as well, and that's kind of one of the highest risk times that I find in terms of actually traveling to the office. Once I'm actually here with the nature of the work I'm doing, and I'm often on my own, which can be a good thing in terms of air quality, but actual getting here is also a bit of a struggle. And I kind of find something interesting that I find is that some people seem to be quite aware of the risks of air on public transport. You see more people wearing masks and things on public transport. But then when you get to the office, sort of everyone takes their mask off and everyone's like, oh, okay, we're here now. Everything's fine. the air in here is completely different, so we're all good. And that kind of strikes me as a little bit bizarre. So that's sort of where I'm coming from with my perspective. I'm still learning a lot. I'm not an expert in this area at all. I'm just trying to sort of navigate my way through this and stay as safe as I can for myself, for those I work with, and for those who I live with, or my family, or my vulnerable family members and vulnerable members of the community. I'm healthy myself, and I am so privileged and lucky to be in that position, and I want to make sure I stay that way, but I also want to make sure that I am doing the best I can to support others to also stay healthy and to come into the workplace and be healthy and safe to do so. So that's where I'm coming from. Thanks, Plum, and it's really great to sort of be here and be able to chat about all of this.
Well, thanks very much, Greg. And I think you're pulling out the example of public transport is a really important one as well. And public transport, of course, is also a workplace. We know that ventilation on public transport is really bad. Well, we've got to do better as well for the people who are working in those spaces as well. So yeah, thank you very much for joining us. I'm really glad that you are able to be with us today, and thank you for sharing your lived experience with us. Okay, our third guest this afternoon is Professor David Allen. David is a specialist occupational and environmental specialist in occupational and environmental medicine, and is an adjunct associate professor at the University of New South Wales School of Population Health. He has 33 years experience in occupational medicine and is actively involved in teaching at both undergraduate and postgraduate levels. David, thank you so much for being here today.
Thanks, Plum. My pleasure. Well, I coming here and speaking today, I mean, I reiterate some of my horror over what's happened in the last 5 years. As an occupational and environmental physician, one of the fundamental things is protecting the workplace, protecting workers and visitors. And I've got to say, when this happened, I was absolutely horrified at the lack of protections in healthcare and in the community and workplaces. And it was frankly a significant moral injury from this whole thing. But I mean, just by way of comparison, typically every year we would lose about 4,000 people from asbestos-related diseases. That road toll's about 2,000. COVID plus other respiratory infections that are airborne is well over 5,000-6,000 a year. Now that's ongoing, and the measures that we go to in occupational health to prevent people getting exposure to asbestos or other risks are extensive. We go to extraordinary measures to minimise risk from anything, let alone airborne contaminants. So all of these things are largely preventable. So if I said to you, would you enter a building if you knew there were significant levels of asbestos in the air inside? Well, no, you wouldn't, not without protections. I remember, talk about air quality. I did my master's in occupational health back in 1988, and we learned about what was called sick building syndrome, which was illness or poor work performance due to airborne contaminants in buildings with poor ventilation. We were taught not by physicians, health practitioners. We were taught by engineers and occupational hygienists, scientists. So I had a little bit of an understanding of HVAC systems, how they work, how you increase the air intakes with appropriate systems to minimise airborne contaminants. Well, little did I think, back 37 years ago that we'd end up with a terrible pandemic where that knowledge became really important. And the sad thing about that is that we haven't utilised the knowledge and expertise of engineers and hygienists to anywhere near the extent that we should have. So along came the pandemic in 2020. For instance, I had a very large household name employer in Australia ring me, and because the chap who ran their safety systems used to work for me, and he said, what do we need to do to reduce the risk of transmission in the workplaces to our workers and to customers? And I said, well, look, can I talk to your engineers, your ventilation engineers? He said, yeah. I said, well, can you aim to get your CO2 levels under 800 parts per million? Because that's what we think is a reasonable threshold. And they said, yeah, we can do that. It happened. It just across the whole country. It's tough for for workplaces with some modicum of understanding, this is not difficult. So, you know, I mean, but the other obvious exposure is, you know, hospitals and aged care facilities. And, you know, my observation of, or what I learned early on, was that the very few hospitals have an effective safety management system, and there's certainly their safety audits. I mean, like very large employers would be auditing their safety systems. Their auditing clearly failed because they were having, you know, knowing that their airborne contaminants are not being mitigated, such as, you know, speaking to an anaesthetist who are intubating patients with, you know, they may have tuberculosis or active influenza or RSV, intubating them with a surgical mask on, which doesn't provide adequate protection. And the sad thing about it is they're not even taught in their curriculum to protect themselves, how to wear PPE. And the other part is the PPE was not taught to infectious disease physicians. So we had infectious disease physicians criticising occupational hygienists and occupational physicians for wanting to use good airborne mitigations. It's absolutely shocking. But I think the most shameful betrayal was, you know, people who are at risk, who are in, you know, in healthcare institutions and in aged care. And unfortunately, that's ongoing. And whilst some hospitals and other facilities might be taking appropriate measures, there's no accountability for this. And the sad thing is people are dying every day from largely preventable airborne transmissions. And I think that's utterly shameful. I mean, as Plum mentioned, employers have a work health and safety duty of care, which is written into legislation. This is an entirely foreseeable risk that people are going to be made sick from airborne infections, airborne contaminants, and the word needs to get out there. You know, they are putting their staff, their workers and visitors, and vicariously those visitors and staff's families from transmitting potentially fatal infection. But in essence, we need to apply engineering principles. And I think one of the disappointing things is that healthcare facilities, workplaces are not leaning on the expertise of engineers and occupational hygienists. I mean, I'm old enough and have enough training to know a little bit about mitigating airborne contaminants and airborne risks, but, you know, we need to use the expertise of our engineers in HVAC and in occupational hygiene to reduce these risks, and it's not difficult. So the basic fundamentals are measuring carbon dioxide as a proxy of the amount of fresh air to reduce contaminants. You know, increasing air intakes in ventilation systems, opening windows, wearing tight-fitting respirators, using air purification devices appropriately, but also auditing safety systems. You know, if you're, you know, I also, one of my other hats was auditing, and you know, this is not a secret that there's a problem going on, and the fact that people aren't mitigating this, or at least to my knowledge, is really concerning. But in essence, we need to lean on our engineering colleagues, and the ones I've met through this the last few years have been incredibly conscientious and helpful. And at the end of the day, you know, whatever we do in mitigating risk will save lives, but it'll also save money. Thanks, Plum.
Yeah, absolutely. Thanks, David, and thanks very much for sharing your expertise. And it's brilliant that you brought up the role of workplace health and safety, because our next guest is Liam O'Brien. Liam is the Assistant Secretary of the ACTU. Before joining the ACTU, Liam was the Victorian Assistant Secretary and National Vice President for the Australian Workers' Union, which is the AWU. It was there that he fought for the rights of workers across the diverse range of industries that the AWU represents. As a national official, he led the AWU's work in the aluminium, aviation, glass and construction sectors. I'm glad I don't have to say that acronym again. As ACTU's Assistant Secretary, Liam is responsible for leading the movement's policy, industrial and campaigning work on work health and safety and workers' compensation matters. Liam is passionate about the rights of all workers to have safe, healthy and decent work, and is a member of Safe Work Australia and the Asbestos and Silica Safety and Eradication Council. Liam, thank you so much for joining us today. It's great to have you.
Thanks, Plum. We do love a good acronym in our movement. Makes life very difficult for those that are not necessarily familiar with it. But also thank you to you for not just for the webinar, but for the work that you do on this issue. It's really important, and it's important space to make sure that these voices are heard. If I can also start by acknowledging country. I'm here in Melbourne on the lands of the Wurundjeri people, the Kulin Nation. Pay my respects to elders past and present, always was and always will be Aboriginal land. So as Plum said, I'm an Assistant Secretary of the ACTU, and in one of my roles, I get to lead our movement's great work when it comes to occupational health. And so I'm going to probably touch on a lot of actually what David just talked about. But I probably want to start by talking about the idea of health, in particular work health and safety, as a fundamental right. So work health, the right to a safe and healthy working environment is now enshrined in the ILO's constitution as a fundamental right at work, and it sits alongside other fundamental rights like the right to organise, protection against child labour. So this is a really important time because it was only recently in 2022 where that right was elevated. And I think thinking about this from a rights-based framework is a really important way in which we can think about how we can advance some of these issues. And as Plum and others said, you're really in the midst of this sort of paradigm shift in terms of the idea of indoor air quality or air quality more broadly as being fundamental to our health, and in particular fundamental to our rights for a healthy and safe working environment. But I would argue it wasn't really just COVID, or COVID definitely accelerated our understanding of the importance of air quality. But actually, for our movement, it really preceded that. And if we look immediately prior to COVID and just look at the summer bushfires that blanketed the East Coast in 2019, every Australian living in those cities had a really great appreciation that air quality was fundamental to their health. Like, you could not walk in any of our capital cities on the East Coast through that summer without having it sort of front and centre. It was quite a visual experience as well. But as David said, for working people, air quality is a huge issue. We think about the impact of sort of air quality on our health compared to other hazards at work. Air quality outstrips all other hazards at work. We lose, sadly, 200 Australians every year in work-related accidents. We lose orders of magnitude greater than that. A low-end estimate would be something like 5,000. That would really just be capturing asbestos and silica, not counting all of the other airborne contaminants, the 15% of workers that are exposed to vapors and fumes in the workplace. And so for our movement, and I'm really glad David talked about it, the idea of pollutants in the workplace, the idea of not having safe, clean air is something that really is sort of front and center and has been a real focus for Australia historically. We were one of the first countries to ban asbestos. We've got some of the tightest regulations, soon to be even tighter again when it comes to asbestos. We're also one of the first countries in the world to ban engineered stone products and create some of the lowest occupational exposure limits in relation to silica. And indeed, there's a lot of work that really can be done there. And it's about using our work health and safety framework. And as Plum said in her report outlines, the idea that our health, and as importantly also mentioned, productivity is really impacted by indoor air quality is well documented, and it's something that we should really be leaning on at the moment when we think about how we can fix some of those gaps in our work health and safety framework. As David said, our work health and safety laws place a primary duty on all employers in this country, not just all employers, it's broader than just employers, to ensure the health and safety of workers and others. So, and others is a really important thing. So whether you're a workplace that doesn't have visitors in there, or if you're a public-facing business that does, you have to think about air quality, not just for workers, but also for those that are going to be entering the premises. We also have specific regulations that deal with certain recognised hazards. And this, I think, is an opportunity for us to maybe think about how the framework can be tweaked. We have regulations, as I said, that deal with airborne contaminants like asbestos and silica. In fact, we've got close to 600 different airborne contaminants that there are specific occupational exposure limits for, including carbon dioxide, which is well higher than what necessarily would be appropriate when we think about it as a proxy for rebreathed air. But there is a framework that works very well in relation to how we control those sorts of risks. And we would argue that with a few tweaks, we can actually address some of the air quality issues. And we have regulations that deal with the working environment. They're very broad, they're very general. Essentially, it requires us to have air that is safe and provides no real guidance of what sort of safe might actually look like other than those recognised hazards. And so we think there's a really good opportunity to make some changes there that might specify some standards that we could include in our work health and safety framework that provide better guidance for duty holders, provide enforceable standards for workers who, as I said at the start, thinking about this as a rights-based framework, workers have rights to ensure the health and safety of their workplace by exercising some of those rights in a workplace. And we're doing a lot of other work in relation to biological hazards. We'll soon have a code of practice, which hopefully we might have a bit of a discussion about a little bit later. But there are good opportunities for us to start advancing this issue. And we think this is an important area for our movement to be focusing on, not just because, as has been pointed out, poor indoor air quality disproportionately affects vulnerable groups and has huge opportunities for increasing participation in the workplace, but also for general health. But we know that every worker, no matter where you work, is affected by air quality, and in particular indoor air quality. And so we think this is a great opportunity to build a really broad and diverse set of stakeholders that are willing to push around how do we strengthen our work health and safety framework to better ensure that right to good quality, safe indoor air, and really ensure that every worker in this country achieves that right to have a safe and healthy working environment. So I really look forward to continuing the discussion, Plum, and thanks again for the opportunity.
Yeah, well, thank you, Liam, and also thank you also for your movement's commitment to this area. It is great to have your support. There are so many opportunities for making indoor air quality safer for everyone to breathe. And just going back to our report, obviously, that you joined us to launch in November last year, our core recommendation in that was the need for indoor air quality performance standards that effectively reduce the risk of exposure to airborne pathogens or other airborne pollutants to the lowest practicable level. And obviously, that's something that we're continuing to advocate for, because we really need a standard that people can be held accountable to. That's what's missing, I think. Fantastic. Thank you, Liam. Okay, and finally to our last guest, who wasn't able to join us today live, but who has done a pre-recording with me last week. Professor Christhina Candido directs the Sustainable and Healthy Environments Lab, also known as the SHE Lab, at the University of Melbourne. She has led studies in surveys in 250 buildings located in 5 continents. She is Global Research Advisor for the International Well Building Institute, Well Faculty, and triple IWBI award winner. Now, just excuse me while I deal with the technical challenges. Let's see if this will work.
Thank you so much, Plum, for the invite to join. This is such a topic that is very close to my heart. So in this presentation, I'm just going to tease out some of the elements that we have been observing in high performance environments. So this is really data coming out of the field, sort of 200 buildings that we have been doing research over the years. It's a pleasure to join today. So when we look back, 10 years ago to now, and of course, having the pandemic in the middle, what our research is actually demonstrating is that the expectations are actually have been changing and have been changing over time. When it comes to office buildings, particularly within the Australian corporate real estate market, we knew back then, as we know now, that workers do have very high expectations about the quality of spaces. What is quite interesting to see is that post-pandemic, if I would plot this exact graph, you would see health and well-being coming back, a little bit down in the list of priorities. And what we're actually seeing is the pandemic was a really strong push towards people having that front of mind. So it was already ticking along, but I think from the end user's perspective, having access to spaces that will actually support and have a positive effect on their health and well-being is no longer a nice to have, is actually a must have. So I think with that in mind, we really need to be able to assess these spaces to provide the evidence and make sure they are experiencing the spaces that they expect. When we put this back into the context of metrics, so a lot of people say in corporate real estate that you can't really manage something that you're not measuring. Metrics also need to evolve. So researching in buildings, particularly commercial buildings and office buildings, of course, is very much indoor environmental quality centered, which is, of course, is very important and central to delivering healthy environments. But what we're seeing over the years is looking after that that, or actually concentrating collecting data just on that bit, won't really paint the full picture of the performance, and definitely not the experience and perception of spaces from end users. So what do we learn over the years from this, research conducted in these buildings is that you actually need to have a much more complex suite of questions, but also assessment points that people be able to engage with, and that you're going to have to be able to create this conversation across different aspects of performance that is coming from the building itself, from the indoor environmental quality perspective, but also what people think. Over the years, what we also managed to provide evidence is actually in the links between base building provision and the layout or the office fit out. And what we see, if you take acoustics, for example, which is of course known as the underperforming aspect of any office environment, it's actually not so much about the acoustic itself, although it's very important, but you can never solve acoustic related issues without actually having fit out that supports people properly. So in actually understanding how these things interact within this space, you can start to provide a better marriage between base building provision and fit out provisions, which is really quite hard because base building provisions are there. They are provided by the building and the building owners. They are set most for a very long period of time for the life of the building. But the fit out is something that is bound to change, particularly within Australian corporate real estate, where fit outs have a life shelf that is forever kind of decreasing it. So this kind of friction between a provision that is set and it's supposed to be rigid and it won't change it so much, you're going to fine tune, of course, but it will be there as infrastructure. And then a fit out that is always changed should be front of mind when we're trying to achieve high performance environments from the end user's perspective. What the research has also been able to demonstrate is that investing for health actually pays back. So again, with that logic of where we want to set our baseline and where we'd like to set a high performing baseline, we need to shift the conversation about the cost in investing on the cost of not investing. So what our research has been able to demonstrate, if you take well-certified workplaces that are over 400 million square meters of well-certified environments globally. And up to this date, to my knowledge, there are only 11 peer-reviewed papers published globally. 2 of these papers were led by my team. And this paper, which is the most recent one, actually, we were able to demonstrate that well-certified workplaces, when compared to high-performing workplaces within the APAC region, actually delivered uplifts of up to 15% in terms of perceived productivity, as reported by the building occupants. Now, if you actually, taking the idea that I said, what is the cost of not investing? But when you think about what large tenancies and workers have to gain from it over their life, occupying spaces that will providing them with the health environments they are after, you actually have to gain from a perspective of talent attraction, but also, of course, make a significant positive contribution to people's life over their life. So, the people need to keep in mind these types of data. And then, of course, integration is critical. If we take, we need to actually take a way of approaching these problems that is no longer isolated. I think there is a lot of movement towards that direction, but of course there is a lot of work to do. But when we look at across the buildings that we have done work with and in it, that is spaces that tend to achieve high performance targets as reported by building occupants, they will have integration as front of mind from the onset when they actually trying to think about the strategy for that particular workplace, how this space is going to support that all the way down to the day-to-day operations, and how they're maintaining and they're actually listening to the occupants, getting the evidence, acting on the evidence, and improving as you go. So it's a commitment over the period of time that you occupy in this space, which can be quite long. And then finally, what we also see is that reporting, very much like certification, and then of course the need, which is the biggest gap in terms of standards, so everything that can be mandated. But I think introduction of carrots, as in reporting and certification, can actually really help shift the market towards the right direction. When it comes to indoor environmental quality, indoor quality, that is definitely one of the pathways to achieve certification, and that has been leveraged by organizations, particularly within the APAC region, to meet the ESG targets and the reporting around environmental and social aspects. So I think there is a fair bit of work that we need to do in terms of the metrics to actually help people reporting on the things that matter as we go. Thank you so much. I look forward to talking about some of the findings with you.
Christhina, thank you so much. That was a really brilliant presentation, and I have got so many questions. I feel like we could talk all day about the findings from your research. But given we're a bit short on time, I'm just going to jump into one of the things that really interested me about your presentation was talking about how investing in health pays back. Air quality improvements are often seen as an expense, but what do you see? You spoke about the cost of not, and it's a phrase that I love. What are the missed opportunities when we fail to invest in safer indoor environments?
Thank you, Plum. That's such a great point. I think, of course, what we can learn from the research in workplaces, and I think I get very excited about that. It's pretty obvious that if you invest in delivering high performance and if you commit to delivering high performance environments, you can definitely have a lot to gain from it in terms of productivity, creativity, overall satisfaction with the workplace. So, of course, that is very workplace centered. So the first thing to do is, one, to answer your question, we need to be able to get data from other building typologies, because of course workplaces, particularly within APAC, they have very high standards. Mm-hmm. And actually being able to get data from other places, we'll be able to get into the same or similar relevant metrics. The other thing that of course is the missing bit here is establishing the baseline. The reality is our baseline of expectations for all the building typologies that not corporate real estate, it's too low. Yeah. I would, along with many other of my colleagues, also argue that we can do better, even better within workplaces. But the reality of the matter is workplaces are far ahead within the Australian market because there are mandatory compliance into place that actually has really pushed the market, and it's a very competitive market. So there are cultural drivers in there. When it comes to all the building typologies, if we take schools or if we take residential buildings, we don't really have the same carrots built into the market to be able to shift the needle. So I think to be able to really establish, health pays back, of course it does, because it's over the life of a person in the community. But at the same time, we also need to be able to shift our expectations of what the baseline is acceptable across building typologies.
Yeah, and I love that you brought up schools, because obviously as a workplace, they, unlike kind of corporate real estate in the middle of the CBD, schools typically have terrible indoor environmental quality and yet are workplaces. So, somehow we've got to raise the tide for everyone. From a universal design perspective, obviously we've done a lot on, designing for neurodiversity. How can we, with the new knowledge that we have around the way that diseases transmit through the air, and obviously safer air projects, push for indoor air quality to be recognised as an accessibility and inclusion issue, how can we get indoor air quality sort of included into that universal design framework?
It's the definition of introduction of barrier, isn't it? If you can't breathe proper air in any indoor environment, and if it's not safe for you to do so, what are we doing? So we have been sleepwalking in terms of the links between, it's not for the lack of evidence, the evidence is there, but there is a perception, perhaps because we can't see it, we don't relate to the other indoor environmental quality parameters the same way. But if we go through the hard evidence, it's there. I mean, there is no discussion, the impact of indoor air quality on people, it's there. So I think it creates an opportunity, right, And that's why I'm such a strong supporter of the Safer Air project and the work that you are leading. It's a breath of kind of fresh air in the sense, because it really establishes a link that I think it will change the perception, especially of those who are leading the implementation of targets, baselines within buildings. If we actually take a lenses of design for inclusion, actually air being part of that, which of course has always been, I think it's such a powerful message that needs to be out there. And I really do believe we'll get a lot of traction over the years on this point.
Yeah, fingers crossed. That's our hope too. Just one last question before I let you go. If we could design Australia's workplace standards with inclusion and indoor air quality in mind, what are the top 3 features that you would potentially include? What would be your?
I think we have a unique opportunity, and that is to mandate it.
Yep.
I think we have the model, we have the experience, we have the culture, we have experienced the benefits and the profound impact of neighbours' energy had in the way the buildings are operated within the commercial sector in Australia. We should have a similar model where we actually mandate disclosure of indoor quality conditions within buildings. And it won't happen just, in one day or the other, but that's, I think, the commitment that we should actually push towards. And it's about harnessing the data that buildings these days, particularly commercial buildings, they are these pulsating ecosystems of data. So there is no shortage of access to data to be able to do that. But at the same time, we also need to harness the data for action on the day-to-day basis, which many building owners do. But I think modeling, the neighbors' energy framework would be beneficial. And then, of course, going a step further and pushing it across all the building topologies. So it's not just limited to commercial buildings, but, as you said, you mentioned safe havens, public buildings. It's such a no-brainer. It's schools, hospitals, and so on and so forth. So I think it really needs to be a commitment to delivering. It's not just about health and well-being. It's actually about safe indoor environments for all of us. So that's what I'd like to see, taking place. And I think Australia is very well positioned to do that. We can do it. I believe it. We can, because of this legacy of the way we manage buildings and commit to disclose data. I think that would be amazing. I hope I'll see that taking place.
So do I. That sounds fantastic. Christhina, thank you so much for joining us today. I hope that when we air this webinar on the 1st of July, you are having a wonderful time somewhere else. And next time, we hope that we will get you in person. So thank you very much for joining us.
Somewhere warm.
Okay. Thank you very much to Christhina. I'm so glad we were able to record that, and I hope you were all able to watch the recording okay. So we're now going to kick off our panel discussion, and we'll bring back our guests, the ones that are here live at least. And then, as a quick reminder, I can see there are a few questions in the chat, but if you would like to, if you have a burning question that you would like to ask, please do make sure that you submit it, and we will try and get to it before the end. And just a reminder that Amy can't unmute you, so if our guests coming back are able to unmute themselves, that would be great. And we'll kick off with a question for Greg and Katherine, really just to explore how indoor air quality has shaped your experience in trying to stay safe at work. Obviously, Greg, you are masking at work, and Katherine, in terms of how you are leading an organisation, and what do you want employers to understand about the barriers that people living with chronic health conditions face in the absence of safe indoor air quality standards?
Do you want to go first, Katherine, or should I?
Go ahead.
Okay, thanks for the question, Plum. So I guess, first of all, it makes me really aware of my privilege in terms of even being able to go to work and wearing a mask and being able to do that. A lot of workplaces you can't do that, or it's not possible, and some people can't even work because they're so unwell. And I just wanted to acknowledge that to start with. But the first thing that comes to mind to me is that everything takes more effort. It's like, oh, just finished my meeting. I've got 5 minutes till the next one. great to grab a quick coffee, you know, but then to do that, I've got to go and get the coffee. I've got to find somewhere outdoors to have it. Got to hope it's not raining. Take the mask off, have the coffee, put the mask back on, get back in. It just takes extra time, like doing all of that, and you don't get that. I suppose that you would expect in an office environment or workplace. You don't necessarily get that social connection while you're doing that because, oh, it's raining. I don't want to go out there and have coffee, you know. But oh well, I don't really have much choice, so I'm going to do it anyway. So you sort of do miss out on a little bit of that. So and that's the same. And in terms of community and like getting to work, like I for example, I usually start my workday earlier and end earlier just to try and miss some of the peak hour transport in terms of getting to and leaving work, just to sort of minimize my risk a little bit there. And things like grocery shopping, so I'll try and do it sort of early in the morning before the space gets used a lot, just trying to do things like that. You've sort of got to be thinking all the time in terms of what you can do to manage your risk and in terms of trying to stay safe throughout your day. My first thoughts. Katherine, go ahead if you want to add anything to that.
Everything Greg said, absolutely true. For me, it absolutely determines the jobs that I can do, and I've definitely missed out on opportunities because I'm not willing to put myself in unsafe environments that will impact me. It's not just for me, but for my family as well. Like we won't work in jobs that are unsafe. For me, I have in the job that I'm doing at the moment, leading inclusive rainbow voices, I can work from home primarily. I actually don't like working from home. It means I live in a bigger house. I need an extra room in my home to do my job, which was not something that I anticipated needing, and it's not something that we should really need if there is an office space that I can use, and it's okay. It's probably a lot better than many, but I just feel safer at home. So I usually work from home, and particularly when we're going through periods of really high transmission as well. So for me, it really has impacted my job opportunities. I also will not get public transport to work. I just can't, it's so difficult. I've, taken a CO2 monitor on the train and the tram, and it sort of shows up red, avoid this area at all costs. And so I just don't do it. So I don't want to work in the CBD, for example. And so there's all of these limitations on the kinds of work that I can do, where I can work, the jobs that I can take. And yeah, it's changed the type of work that I do in a big way. I love doing community development work. I love working with people, but I found that those jobs there's just not a lot of regulation or acknowledgement in those workplaces where you're sharing with a lot of other people. So yeah, it's had a huge impact on my life. And particularly obviously during since 2020, it's just completely kind of turned everything upside down. And I do enjoy my job now. I have to say I really appreciate that. And but it sort of felt like, well, now that I lead an organization, I can make the rules. Is that what it takes? Surely not.
And Katherine, as someone who's been sort of advocating in the sort of disability inclusion and accessibility space, have you found it odd that sort of this kind of new way of thinking about the air that we share indoors? Have you found it odd that people don't see it immediately?
I found it really odd the way that people ignore the evidence, and I find that really just disturbing. We know that people with disability are so severely impacted, and even looking to our vaccine rollout, like from start to finish, or not finished, from start to now, during the pandemic, we've just seen people with disability really left behind. And we need better leadership from our disability advocacy organisations as well. Like some of them are doing really well, and some of them are not really acknowledging it at all. We're putting on an event on Sunday, for example, that's sort of COVID safer event, and that's so rare to actually have an event that's properly thinking about ventilation, masking, asking people to mask and test, and sort of providing a safer air. So I found it really shocking, to be honest.
Katherine, thank you for your leadership in doing that, and let's hope that other organisations will follow suit. Thank you. Moving on to a question about workplace safety and inclusion. This is probably a Liam and a David question. Why should indoor air quality be treated as a workplace health and safety? Obviously, we've heard from Katherine and Greg, but what from both of your perspective, what do you see as the sort of the main the main drivers, and are we seeing it being taken seriously enough by employers or regulators? I think that might be a trick question.
Do you want to go, David?
Look, the simple answer is, if you don't have safe air, people die. I mean, in health and safety, the idea that you would knowingly allow people to be harmed is just, it doesn't exist. And if you've got other contaminants or other hazards, in the large organisations I've worked with on my whole career, managers lose their jobs over people getting hurt. We're talking about something that can kill people. So it's just so obvious that it fills me with shock, horror, and shame that people are still being harmed by something that is so manageable.
Mm-hmm.
Look, agree. I mean, put simply, as I said before in my opening, I mean, employers, duty holders, as we call them under the Work Health and Safety Act, have a duty to ensure the health and safety of workers and others. The regulations set out specifically that they've got to ensure that there's ventilation that enables work to be carried on without risks to health. So this is not up for debate. A lot of people talk about where does work health and safety start and end, and quite frankly, the debates often happen around psychosocial issues and other things. This is a no-brainer. This is absolutely clearly within the realm of work health and safety. Now, we say there should be some more specificity there. I mean, it would be helpful if we actually described a standard that says this is where risk to health begins, noting that it's never a clear-cut line. But the more that we can be specific, the more that we can use it as a tool to greater enforcement. To answer your question about, are we seeing enough action on this from regulators? I mean, absolutely not. I mean, I think really disgracefully what we saw during the pandemic is regulators not just put their hands up and say, I don't want to do it, actually abdicate their responsibility in favour of public health orders, which, very supportive of public health orders. They kept the community very safe. They kept the community safer, I should say, but it really missed the opportunity in workplaces to, I suppose, liberate the work health and safety framework, which is much more dynamic, it is risk-based, and it's much more inclusive. So it involves participation of workers and having some agency in their workplace. And this is the great, I think, sort of golden key when it comes to work health and safety and indoor air quality, is that we can set standards, but then we can also use them that are context specific. So when we think about vulnerability, I mean, a great example is that in high risk settings like aged care, we do have to have an even greater focus around air quality, not just because of the vulnerable people there, but obviously also because of the workers there. I mean, we think about productivity. We are scrambling to find enough people to work in some of these sectors, and yet we are exposing workers to ongoing risks that not just make them sick, but make them absent. So the benefits, I think, are huge. And as I said, these are not significant tweaks. It is a mindset shift. I think we need to think much more holistically about health when it comes to work health and safety. I think too often my own experience, and I come from one of those unions that are sort of blue collar, high risk work, is we don't think about work health and safety in that sort of broader health sense. And so as a result, we need to change that paradigm a bit to make it much more inclusive, a field where we can drive better action. But I think this is absolutely a work health and safety issue. It's a fundamental right for workers to be able to participate in work. And it's a thing that is denying many tens of thousands, if not more, people from being able to go to work, which is, as I said, a basic thing for human dignity, but also a huge productivity boon for the country.
I find it really interesting that there is that sort of key point around ventilation, and yet it's not really being adopted. Do you have any kind of sense as to why it's sort of easily ignored?
I feel like in my discussions, I think when we think about ventilation, we often think about, the future problem of designing buildings, when actually there are really practical steps that can be done to retrofit existing buildings, to look at indoor air quality. I was just at a conference last week, and in the conference centre, it was overseas, they had these great visual screens that actually in static recording of indoor air quality, and you could sit there and you could see it. And so as a practical thing, just the way that created awareness in the room about the number of people there, the good or lack of ventilation, I think, are things that are really practical that could be done, that at least become signals to people about where your risks might be elevated. And I think it will drive better approaches in workplaces. So I do think the problem with ventilation, I think it's the problem with all hazards you can't see and touch. Like I said before, the things that kill us are the things that we can't see. So, asbestos and silica are great examples of the hazards you can't see and touch necessarily as an airborne thing. Psychosocial hazards are another one. You can't see and touch them, and they're cumulative. They're not necessarily a single event. We're pretty good at guarding the plant and equipment's going to chop off our arms, or ensuring there's fall protection where there's an immediate risk. What we're not very good at, and it's human behavior, is how do we control risks that are chronic, that accumulate over time. And so I think the more that we can do to give visual representation to them in workplaces helps change everyone's psychology, but also it will force the person who owns that building not to be, not addressing ventilation when consistently CO2 levels are above what would be considered a sort of safe standard.
Yeah, absolutely. And the conference you were at sounds amazing, and we should definitely be congratulating them, because that's exactly where we need to get to. And in fact, Safer Air Project are launching a campaign in November around making the invisible visible, because it's we need to be able to see it. I have this vision that we'll walk into Woolworths and there'll be a live indoor air quality monitoring that you can see when you walk in, that it will be in the post office, it will be in all public spaces, so that everybody can walk in it and see, well, what is the air that I'm breathing, what are the inherent risks. You wouldn't sit down at a cafe with a 1-star food hygiene rating and sit and order the full breakfast. You might think twice about eating there, and we should really get to the same state with the air that we breathe. Thank you very much.
I'd add to that, Plum. I mean, and the sad thing about this is so many organisations have the resources to do this now, and they're willing to do this. If only the government, or there were codes of practice published, standards, and they say you need to do this, get your CO2 down, more fresh air. They can do it now, but there's no driver, and unless it's us screaming from the rooftops. It just seems so obvious and easy for us. It's just percentages that the more employers and organisations who improve their air quality, the fewer people will be harmed.
Yeah, absolutely, and it's a great kind of segue into the next sort of section of questions. What does stronger indoor air quality? What does a stronger regulatory approach look like? We obviously, in our report last year, identified a number of regulatory opportunities, namely, the number one being the Disability Discrimination Act. Attached to the Disability Discrimination Act are the premises standards. The Disability Discrimination Act says that all public spaces should be universally accessible. So what about the air that we share indoors? And the premises standards, which define the accessibility features as necessary, including, the angle of the ramp and the height of the button and the assistive audiology and all of these other tools and technologies, I see there as being a real opportunity for indoor air quality performance standards to be written into that particular legislation. I think, obviously, we've got Liam here. Workplace health and safety is an obvious one. I also think the Education Act. We have a duty of care to children, so that I do think there are lots of opportunities. And I'd be interested, Katherine, particularly from a DDA perspective, do you think that that's got potential? Liam, what are your thoughts as well?
I think, there's absolutely potential. I mean, the Disability Discrimination Act, says that people with disability need to be treated equally and be provided equal and dignified access to all public spaces and public life. And, as you said, there's out of that, there's sort of the premises standards. There's also the disability standards for accessible public transport and standards for education. And they kind of articulate the intention of the Disability Discrimination Act as it pertains to those settings. And so I think there's certainly space for that. The Disability Discrimination Act is being reviewed shortly. So there's an opportunity there, absolutely. What I will say with the DDA, I think one of the limitations is that in order, if someone, says, well, I was discriminated against and I was not provided, for provided, for example, a reasonable adjustment in my workplace, which I am entitled to under the law. I wasn't provided that. I was discriminated against. It's up to that individual to go through the process of making a complaint with the Australian Human Rights Commission, and that may be something that they want to do and that they have the resources and support and time and energy to do. But for the most part, that's a huge burden to place on an individual. And then at the end of the day, there's not necessarily a requirement for systemic change at the end of that. There's a requirement to settle that individual issue with that individual person. But I think absolutely it can be used, and absolutely it can be a standard that we're working to. But I think there's we also need to move from this kind of individual thinking into the collective, and I think that's where even looking at things like the building code are interesting pieces of legislation that incorporate elements of those access to premises standards, for example. But I think I think the standards are a good place to go, and I think the building code is also a useful place to sort of a useful tool that we could be looking at as well. I think there's a lot of different opportunities, but I think the review of the DDA will be interesting. And certainly, I think if employees are feeling that they've been discriminated against, that pathway is available to them. And there are organisations that will support you to take that route as well. So I'm not meaning to write it off by any means. It's there and it's a very valid process to go through, for sure.
But it is a huge burden to put on an individual.
Absolutely, it's enormous, yeah.
Mm. I'd agree. I think the standard is the solution. I think we have one missing piece in our work health and safety framework, which is the ability to point to an objective government recognised standard that this is safe, this is unsafe. And so that becomes the tipping point. I know there's a question, I think there's a lot of comments often about, are we just one test case away from everybody realising? I mean, my personal view is that waiting for a regulator to go and prosecute somebody for a breach of work health and safety, I'll be a very old man by the time we get that. And there's many examples of workers that are exposed every day to risks in the workplace that we never see the prosecutions come. And so I think holding out hope for regulators to come and set a standard around this, many people will be exposed in the interim. I don't think the standard is too difficult. I think there are lots of ways in which we can achieve that. We've got good science now that really is able to be translated into practice. So we know from the research of many that we've got global consensus around what an indoor air quality standard should look like. It's really just the will of government to be able to pull that together. And as I said, it's then something that can be slotted into building standards. To Katherine's point about how do we ensure proper disability access, these are the sort of things that can drive it. And when it comes to work health and safety, we reference standards all the time. Many of them Australian standards, many of them are regulated standards, whether it's in relation to these sorts of issues, engineering, all sorts of things we have standards for, and they're very easy to incorporate into our work health and safety framework. So as simple as that is, I think navigating the pathway as to who's going to take responsibility within government to do that work, that's where the rubber hits the road. And so that's why I think it's really important that this community, along with all of those of us that are really advocating for stronger protections for workers in relation to air quality, but specifically indoor air quality, we're able to coalesce around that sort of single ask and really push hard. I think there's a huge opportunity at the moment. Obviously, there's a productivity discussion, and I think it's a great lens, like with inclusion, to drive this sort of productivity argument as well.
Fantastic, thank you. I've just got a couple of, one last question for each of you before we jump into some of the questions that we've had from our audience. Greg, what should employers know about why someone might still be taking precautions? And most importantly, what do you want them to know about how they can be supportive?
I mean, the first thing to keep in mind is there could be numerous reasons why someone could still be taking precautions. They may be immunocompromised themselves. They may have a family member who's immunocompromised. They may just want to keep themselves safe. They may want to keep their community safe. It's not just about COVID as well, where I know people don't like the C word, but it's not just what it's about. There's other airborne diseases. There's flu, there's allergies, there's, dust and particles and things like that, and all the other things that we've been talking about today. And in terms of how they can be supportive, I guess, is just to respect people's right to take the precautions they want to. Each person's different. Talk to them, try and understand them, and take that on board, and then just there's simple things you can do to sort of provide accessibility assistance to people. Just make it as accessible as possible. So, okay, you've got an office or you've got a workplace. Do you have an outdoor area? Is there any shelter in that outdoor area? So if someone does want to pop out, they can do so easily. If not, can you get an umbrella? Simple things like that. And then also just keeping in mind with things like social events or like all team department meetings, when you sort of have a whole office, a whole building gathered together, maybe there'll be people that won't be comfortable to be in that situation. Don't make them feel victimized for that. Make them feel supported and say, it's completely fine for you to, take this from your desk or from at home, whatever you like. So avoiding putting undue pressure on people to come into the office when they don't feel safe to do so, I think is a big one as well. And what was the other one I was going to say was just that, no, I've forgotten.
That's okay. You can jump back in with it in a moment if you like. Katherine, what do you think HR and and teams working on diversity and inclusion should be doing to support employees living with disabilities and other high risk conditions?
I think taking this seriously, I think it's one of those issues where there's so much evidence. The evidence is there. It's just a matter of putting that into practice. And I think it is, I think people kind of look at where we are now. They hear these big words that they don't understand perhaps, and and they don't really know how to measure indoor air quality, or they don't know what to do, and so that feels hard, and it feels like a huge change and a cultural change. And I think the cultural change is something that intimidates people. So I think if you are working in an organization where you're pushing for, as I'm sure we've all experienced, better precautions and safer air, it can be difficult from that cultural perspective. But the evidence is there, and it is your responsibility to keep your employees safe and healthy. And I think it's there are so many reasons, and we can talk about accessibility as well in that, and we can talk about reasonable adjustments, which are, the right of all employees with disability to have a reasonable adjustment to support them to do their work safely. But this isn't just about people with disability, it's about everyone. And it's about, yes, it's also about carers and family members of people who are immunocompromised, but it does impact everyone. And I think that the solutions are there. It's not a big scary thing, and we need to be having these conversations collectively and publicly to show people the path to achieving these, the goal of having safer air and safer workplaces. But the solutions are there. You don't need to invent them, and they don't have to be expensive, and they don't have to be complex. You just need to do a little bit of research, and you'll be able to find what you need to get there.
Yeah, fantastic. I couldn't agree more. And most importantly, that because the tools already exist, it really is reasonable. That they are
Absolutely.
a reasonable adjustment. It's it's not a huge. It doesn't have to be a huge expense. Perhaps David, that's something that you could talk to a bit. I've got a question here for you about the role of occupational health professionals in improving awareness and standards, but also in helping organisations improve their workplaces for those high risk community members, but really for everybody.
Well, they should be leading this. Unfortunately, that's not happening to any significant degree, which I find disheartening. I vividly remember being attacked some years ago, sort of for sticking my neck out and trying to mitigate, trying to influence change, and I think it's fallen off the radar for a lot of health and safety professionals, sadly. That's not to say that they couldn't be advocating for this, but certainly if there were codes of practice and standards, it would just become the norm. That would be easy. But if there isn't, the argument to a large employer from a health and safety professional, unless it's something that they see a business case for, they probably won't do anything about it. So I think, yes, they could play a role, but I don't think they can be a significant driving force without standards that need to be applied. And then we get the engineers involved and the hygienists, and it would all fall into place.
And this is where we need Christhina to respond with the business case, because clearly her research demonstrates that, you know, there is a return on investment to be achieved for organizations that invest in improving their indoor air quality. And it isn't just a productivity gain, but also in, you know, in reducing absenteeism. So I know that her research speaks very strongly to that. Obviously, one of the groups that you didn't mention, David, was the role of unions as well. And I think that when we kind of bring all of these multidisciplinary groups together, we do have a really strong case. So Liam, what do you see as being the next steps? And I wonder if you could just briefly talk. Is it the ILO who are close to?
Yep.
Having
So biological hazards COP. So I think firstly, I'll come back to what I said at the start, like we should think about work health and safety as a rights-based framework. It is not just for regulators or indeed health and safety professionals to comply with the law. It's a framework that enables workers to raise issues. And so the more that we can do as a movement to educate workers about the risks associated with indoor air quality, I think the more that we can put pressure on duty holders such that they engage health and safety professionals as to how they comply. That's how the health and safety framework's there to work. We can't just rely upon regulators to knock on a door and say, show me how you're controlling indoor air quality risks. So I think, you know, notwithstanding what I've said about closing some of the gaps, you know, specifically with a regulation that starts to specify a standard in relation to indoor air quality. As a movement, we are doing a lot on this front, both locally and indeed globally. As you said before, the International Labour Organization holds annually its International Labour Conference. The ILO is the oldest UN agency in the world. It actually predates the League of Nations. It's the longest continuous operating UN agency. It survives world wars, and it survives world wars because of its tripartite structure. We don't rely just on governments. Its members include unions, representing workers and employers. And so I think that framework has started to push this as an issue. And so we've now got a biological hazards convention that was reached 2 weeks ago at the ILO. And so now it's down for member country, for states to sort of adopt and endorse that convention. We're very hopeful that Australia will. But fortunately, we're sort of well on our way to starting to close some of the issues around biological hazards. Bearing in mind, it's not just COVID or airborne viruses. It's a whole range of biological hazards that workers from healthcare right through to agriculture are exposed to. And so hopefully by the end of this year, we'll have a code of practice on biological hazards that starts to set out sort of how duty holders, so, you know, those not just employers, but building owners can meet some of those basic duties. So it's starting to fill out some of the gaps. And to David's point, it should start to inform the sort of health and safety community, but employers in general, about how do I meet my obligations here? And whilst we think there can be some tweaks to our regulatory framework, this is a good sort of first step to start to educate people about what are you doing to control risks in relation to biological hazards. So I think there's some really good work already underway, and indeed our movement is pretty focused on this as an issue. It's not the only, obviously, work health and safety issue that we work on, but it's something that I think universally applies to every workplace as well. So that's why I think it's something that is broadly a good area for us to be campaigning in.
Yeah, fantastic. And I think it's a really, you know, it's fantastic that the ILO is moving in this area, and I hope that will help, you know, Australia and other countries, you know, move a bit faster. So
well, I should say one thing I'd say about the ILO. So it is moving quick. This was something that was recommended in 1980s, and it's taken them close to 40 years to do. COVID definitely helped sharpen their mind about its importance, but you know, it is a slow-moving beast when it comes to getting this done. So the fact that the ILO's even gotten there before many governments have, I think, is pretty telling.
Just imagine if they'd worked a bit faster, you know, and
we've had 4 pandemics since then. So
well, exactly, and you know, and well, maybe we can get there before the next one really takes off. So just a couple of questions. We have only a few more minutes left. Katherine, this one's really for you. What can we do about getting other organizations, other disability organizations, other patient organizations to join Invisible Rainbow Voices in advocating for safer air for their high-risk communities, both in workplaces and in other public settings?
I think that when you have the conversation with people, I found people are open to it. I think there's a lot of fear around it as an issue in our culture, in our society at the moment. I think people feel like they're going to say something wrong. They don't want to be afraid. They don't want to think about it. But I think if you can offer kind of a clear message and a clear, I guess, clear evidence as well, and a solution, if you can bring a solution to people, and that solution doesn't need to be, I know what you need to do, but it can be, I know where you need to go to find out how to do this well for your organization. I do think there's sort of like this threshold for change as well. And I think, even just having this webinar is amazing. We didn't have this 3 years ago, for the most part. And so I think, if we can be building as organizations, we can be building the leadership within other, and particularly larger orgs. We're a very small organization, but particularly speaking to the larger organizations and asking them to take leadership on these issues, and doing that publicly. So to say, in our workplace, we're doing this. I think that is really encouraging, and it can kind of build to that threshold where it becomes the norm. Because I think at the moment we're fighting for, quite basic and small changes for people to make in their workplaces, and it is such an enormous issue that's not being addressed across so many settings. So I think if we can be building that solidarity, organisation by organisation, and really encouraging people, and that's why orgs like unions are so important, because they can empower people collectively across so many different workplaces. And I think that solidarity is really important, and just continuing to have those conversations and to really leverage leadership where you can, and speaking to the leaders of your organisations, because they're the ones that hold the power, really. So I think, just kind of building that until hopefully the dam wall breaks and it does become the norm, and something that we can do better collectively. And this is, of course, alongside the process of standards and things like that. I think this is more the cultural aspect.
Yeah, absolutely. And one of the things that we're trying to do with our community support program is to help build up that knowledge within patient organizations, so that they understand the risks, they can help educate their high-risk communities, but they can also join us in advocating for this change that we so desperately need. I've got a ton of questions here. We will try and get to them, and we will be sharing answers with via our social channels. I'm going to have one last one though. It's going to be, okay, Liam. In Canada, workplaces in Canada, in workplaces, public health took control. OHS inspectors were limited in their powers to issue orders for improved ventilation. Is this the same in Australia, or is Australia in a better place?
I'd like to say we're in a better place. I'd say we're in a better place today, but at the start of COVID, we were in a much worse place. Regulators were not just not acting on those sorts of issues; they took a step to deliberately abdicate their responsibilities. So we saw at the start of the pandemic, all regulators across the country, with a couple of exceptions who felt very uneasy about it, actually took a decision that they were not going to enforce the Work Health and Safety Act when it came to code risks, which we said was an appalling abrogation of responsibility, and actually left workplaces, as I said before, incapable of addressing localized risks. So, one of the big frustrations, and I did say it before, is that we had this sort of very blunt instrument, public health orders. And so essentially we had this sort of uniform community-wide approach to masking and to sort of how we'd manage people in indoor spaces. And so that might have been fine in the early days, but we really never, liberated that sort of work health and safety framework. And I would argue for the next pandemic, I think we all know how difficult those public health orders are going to be for the next time around. Lots of public resistance. And so I think the politics and dynamics around using that framework are going to be very challenging going forward. However, we have this great risk-based framework that actually requires employers and workers to together identify risks locally and apply controls that are appropriate. And so, I think it's a great question, because there really is just sort of no grey area in between the two responses. And I think the Work Health and Safety Framework provides a great opportunity to sort of control risks. And I think we're getting there. And again, if we plug some of those gaps, really empowers the sort of rights holders to sort of put pressure on duty holders to make sure that we're getting safer approaches.
Yeah, fantastic. Thank you to everyone for putting your questions in the chat. For the questions that we didn't get to, we will share them with our panelists, and we will try and get some answers for you, and we'll share them across our social channels. So thank you very much for submitting them. And And really thank you very much to everyone, and a special thanks to all our outstanding speakers, Katherine, Greg, David, Liam, and obviously Christhina as well. I hope she's sound asleep in Europe as we are speaking. And thank you for sharing your insights and experience, particularly Katherine and Greg. I know it's really, really difficult sharing your lived experience, and I'm really very grateful to you both for doing so. It really helps everybody understand why we need to act. So for me, really, the key takeaways are clear. You know, indoor air quality is an inclusion issue. There's no doubting that. It's time that we get everybody to understand that and to start seeing indoor air quality as an accessibility issue. I really truly believe that once people understand that indoor air quality creates an accessibility challenge, that people can start understanding, well, hang on, we've moved on other accessibility issues. We would never say to someone, no, you can't participate in this because you're in a wheelchair. Why are we saying to someone, no, you can't participate in this workplace because you've got a chronic health condition? That we need to move forward, and we need to move forward super fast, because it's just not acceptable. So yeah, that's really the kind of the key thing for me, and I'm really grateful to you all for for helping drive that message home. And I think the other one is really just around we really need to start adding lived experience into all of these conversations. So discussions around workplace health and safety, discussions around Disability Discrimination Act, discussions around workplace health, and they all need to include the voices of people who are being affected by poor policy decisions, because that's how we can make the change. So thank you very much. Thank you all of you for joining. And to our audience, thank you for taking the time to join us today. Your participation helps us grow a stronger and more informed community. So thank you very much for taking an hour and a half out of your day to join us. We invite you to subscribe to our newsletter and follow the Safer Air Project on LinkedIn, Facebook, and Blue Sky. I think that Amy is putting some links in the chat, so do check those out before you leave. And a final thanks to our generous sponsors, especially our major sponsor Camphil, and our supporting sponsors Erlab USA and Sealy International. If your organisation is interested in supporting our work, please do reach out. We would love to hear from you. So yeah, please check out those links. And that's it. So thank you very much, everyone. It's been great, and please do reach out to us via the website.